facilities 1,057, and number of those recovered from community cases are now at 1,503. By way of additional cases, during the last this morning, 54 additional cases were reported. 21 persons have been discharged from our public health facilities, and 85 are recovered from in terms of community care. By way of our hospital, we're looking at the Couva Hospital and Multi-Training Facility, where we have 59 persons. 6 of those are in ICU, 5 in the high dependency unit. At the Arima General Hospital, we have 5 persons in total, 4 of which are in ICU. At the Cora facility, there are 39. At the Augustus Long facility, there is 1 positive. St. Anne's Hospital, 3. Scarborough Regional Hospital at the Fort, there are 2. And Scarborough General Hospital in Signal Hill, there's 1 person. In terms of our step-down facilities, we have 11 individuals at this time, 6 at the UE Davie and 5 at the Tobago facility. As you noted, there have been significant discharges from both Canada Hall and Freedom Hall as of yesterday. In terms, I just have one slide that I wanted to use this morning. For the purposes, I think we had a few questions coming in related to the number of swabs that we are receiving on a daily basis for the country. So if I could have the first slide. So basically this slide shows for the county of St. George East the number of viral illnesses that are presenting to the entire county by day. So it gives a 2-week period from the 13th of September to the 27th of September. So the blue line gives the number of COVID tests or the swabs that would have been conducted during that period. The orange line, which are the viral illnesses presenting to the same facilities. So if you notice, the blue line mirrors the purple line very closely, meaning that the swabbing is of course a function of the number of people presenting to our facilities, which is where we get the majority of our swabs taken. We have some swabs taken outside of this. This will represent the primary healthcare centers. Some swabs are taken outside of this for contacts. For instance, we have to go home to persons' homes. Those will not be represented here. So basically for St. George East, what we are seeing is about 87% of persons presenting with viral illnesses are being swabbed at the various facilities for this 2-week period here. Similar trends are being seen in the other counties, but I'm just using this to give an idea of where we are at in terms of the way we swab our individuals as they present and the percentages of swabbing based on the viral illness. So about 87% thereabouts for St. George East. What we are seeing nationally in terms of our swabbing coming in to be tested, there has been a little decrease over the last 2 weeks as well, where we see us going from a state of about 600 to 700 swabs per day nationally to somewhere between 400 and 500. So there has been a decrease consequent on the decrease in viral illness that is being seen. And again, based on this graph, we see that it is a function of the viral illness presenting in general. So I just wanted to bring out that point this morning before I close my clinical update. Thank you, Ms. Alcantara.
And thank you very much, Chief Medical Officer. Now, Ms. Sukhchand will give an overview of the influenza or flu vaccine.
Thank you, Candice, and good morning to all of our viewing audience out there. So, can we go to the slides, please? Flu is a contagious respiratory illness caused by the influenza virus that infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. Next slide, please. Types of influenza virus. Influenza A and B virus are responsible for the seasonal flu epidemics each year. The flu virus can change. Influenza viruses can change in 2 different ways. We have what we call the antigenetic drift and the antigenetic shift. The influenza A H1 virus that emerged in 2009 caused the first global influenza pandemic in more than 40 years. Next slide, please. Flu vaccines protect against 3 or 4 viruses depending on the vaccines that research suggests will be the most common. There are many different flu viruses and they are constantly changing. The composition of the flu vaccines is reviewed annually and updated as needed to match the circulating viruses. Flu season usually begins October of one year and end around May, June of the following year. According to WHO, for the 2020-2021, the trivalent, three-component egg-based vaccines is recommended for this season, and that is a vaccine that the Ministry of Health has procured. Vaccines' effectiveness can vary, and recent studies show that flu vaccination reduces the risk of flu illness by between 40 to 60% amongst the overall population during seasons when most circulating flu viruses are well matched to the flu vaccines. High uptake will help to ensure that limited health resources are available for our COVID-19 patients, and we are therefore seeking to avoid overwhelming our health system. We are therefore urging the population to take the vaccines early because it takes approximately 2 weeks for persons to build immunity against the virus. Next slide, please. So we go to the safety of flu vaccines. The flu vaccines is safe. Vaccines, like any medicines, can have side effects. Many people who get an annual flu vaccines have no side effects at all. Most side effects from flu vaccinations are mild and go away on their own in a few days without any treatment. Severe allergic reactions following vaccinations are rare. Soreness, redness or swelling at injection sites, or a mild flu-like symptoms that disappears within 2 to 3 days, or fever. So most of our reported side effects, as I said, would have been soreness, redness or swelling at the injection site, mild flu-like symptoms as listed, fever, headaches, fatigue, and in some rare cases, vomiting. Next slide, please. So why get the flu vaccines? Getting a flu shot can help you either avoid the flu or at least lessen the severity of your flu symptoms. Also, because symptoms of the flu such as fever, cough, or fatigue can be mistaken for COVID-19, getting a flu shot can potentially help rule out influenza if you do start getting sick. Both COVID-19 and the flu are contagious respiratory illness that are caused by different viruses but has similar characteristics and can present with similar symptoms. Both viruses can impact the elderly and those with certain chronic conditions such as heart and lung disease the hardest. It is therefore important to get the flu vaccines for personal, family, and community protection. Next slide, please. Who should be vaccinated? We encourage everyone to get vaccines, but some groups are more at high risk. Children aged 6 months to 5 years, adults 60 years of age and over, pregnant women, persons suffering from non-communicable diseases, as we said before, diabetes, hypertension, heart disease, persons compromise immune systems, for instance, persons with lupus, cancer, persons with chronic respiratory illnesses like asthma, chronic obstructive pulmonary diseases, and members of the National Security Forces, Customs, Immigration Division, and of course, our healthcare workers. Next slide, please. So where and when to get vaccines? At all health centers. And this is given at no cost nationwide. You can go also to www.health.gov.tt or relevant social media pages for schedules. Some health centers offer Monday to Friday, that is 8 a.m. to 4 p.m. And you can also call health centers or visit again the website and social media page of Ministry of Health and Division of Health, Wellness and Family Development at the Tobago Health Authority for details on the available schedules. And it would be remiss of me not to take this opportunity. So can we go to the next slide, please, to mention a little bit of child immunization. As the COVID-19 pandemic spread throughout the world, it has caused a change in how the Ministry of Health continued to provide essential services to patients. Ensuring immunization services are maintained is essential for protecting individuals and communities from vaccine-preventable diseases and outbreaks and reducing the burden of respiratory illness during the upcoming influenza season. The Ministry of Health has listed childhood immunization as part of the essential health services, prioritizing primary vaccine doses while ensuring strict infection prevention and control measures are in place and maintained. Block appointment system has also been implemented and physical distancing in waiting rooms. The Ministry of Health also emphasizes the importance of vaccinating children who had missed their routine doses and prioritizing them as soon as possible. We are therefore asking parents and guardians to please contact your nearest health center to have your child vaccinated. Some public health measures. Public health measures are in place to protect the population accessing vaccination services. COVID-19 protocols are in place at all health facilities. We are asking persons to wear masks, maintain physical distance, wash and sanitize hands before entering the facilities. And of course, health screening is readily available. If you have any flu-like symptoms, please inform a member of staff. And of course, the new normal guidelines help prevent the spread of the flu as well. So the new normal guidelines, again, just to reiterate, wear a mask over your nose and mouth when you go out in the public. Keep your distance from others 6 feet. Stay home if you are ill. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Cough into a tissue or into the crook of your elbow. Avoid touching your face. Clean then sanitize surfaces, example tabletops, doorknobs and cell phones. Back to you, Candice.
Thank you very much, Ms. Sukhchand. And now we welcome Dr. Adish Surju Singh, Director of Women's Health, to address us on COVID-19 and influenza-related considerations for pregnant women.
Thank you, Ms. Alcantara, and good morning to the Chief Medical Officer, Ms. Grace Sukhchand, members of the media, and the viewing and listening public. I represent the Directorate of Women's Health, and this is a recently formed unit at the Ministry of Health. We are responsible for improving the health of our mothers and newborn infants. So this is actually a follow-up discussion on COVID-19 and its relationship to pregnancy and the newborn infant. It is based on the continued scientific evidence. I would also like to speak to related to seasonal influenza and pregnancy. Written information on COVID-19, written information on influenza, and many other health-related issues of women can be found on the webpage of the Directorate of Women's Health, and you can find this on the Ministry of Health's official website. As always, there's a disclaimer to this information. The information remains very dynamic and may change at short notice. Please stay updated. So firstly, I would like to just update the public on what has been happening with our maternity services. Our public maternity services continue to perform exceptionally well during the pandemic. All maternity facilities and services continue to function as normal. These include outpatient services, inpatient services, such as normal deliveries, cesarean sections, as well as our newborn neonatal special care services. Our benchmarks of performance, which we monitor continuously, namely the maternal mortality and neonatal mortality rates, remain at its lowest levels in decades, which are all in keeping with the international targets which are set for the Sustainable Development Goals of 2030. You've heard we have over 4,500 positive COVID cases in Trinidad and Tobago. So it was inevitable that pregnant women would be affected. We have had a number of cases, some of whom became very ill, but due to patient confidentiality, I would not be going into any details. However, needless to say, all patients have so far been successfully managed in our public and parallel healthcare systems. To remind the public, the scientific evidence concerning COVID-19 and pregnancy remains of concern, but is still quite reassuring. The overall consensus remains that if you are a well-pregnant woman, if you get COVID-19 infection, there is little additional risk to yourself or to your baby. It is similar to that of the general population. It does not mean, however, that you wouldn't get ill. There are certain high-risk patients. You've heard this before. And these include being overweight or obese. If you have any pre-existing medical conditions such as diabetes, high blood sugar, heart conditions, asthma, cigarette smokers, hypertension, sickle cell disease as examples. And the textbooks say being older when pregnant. Now, I don't make these ages up. I have to have a little disclaimer. These are young people. But if you're 35 years and above, and if you're in the last few months of pregnancy. I will now move on to the issues related to influenza and pregnancy. And as you heard from Ms. Sukhchan, she gave a good overview of flu and the flu season. So we are now in the flu season. As every year, Trinidad and Tobago records an increase in cases in the last few months of a year and into the few months of the following year. It doesn't mean that flu isn't around. It's around all the time, but that's when we tend to see our peaks. What this means is if we have a bad flu season, these additional flu cases require the exact same resources as patients with COVID-19. They need general hospital beds, HDU beds, and ICU beds. The flu is also a cause of deaths, with over 41 documented cases in the last season spanning from 2019 to 2020. And just to clarify, when we say influenza, we do not mean just H1N1, as you heard from Grace. H1N1 is just one type of the group of influenza A that causes the flu. And influenza has very similar clinical features as COVID-19. As healthcare workers, we cannot tell which is which until it's confirmed sometime later in the laboratory. The same measures to reduce transmission of COVID-19 have also been proven effective in reducing the transmission of the flu. And a broken record, we're going to say the same message over and over. Stay at home if you're ill, physical distancing, wash your hands, correct wearing of masks, sanitizing often, and proper cough and sneeze etiquette. We actually have a safe and tested vaccine that gives gives us some level of protection, between 40 to 60% protection, as you've heard, for this flu. The vaccine we are using this year is an updated preparation from last season for virus strains that were recommended by the World Health Organization. It protects against 3 types of influenza viruses: H1N1, H3N2, and a type of influenza B. Now, why is vaccination in pregnancy important? Ms. Sukhchan already said pregnant women are a very vulnerable, high-risk group. They may get extremely ill in some cases if exposed to the virus. Up until 2018-2019 season, every single year, pregnant women became critically ill because of the flu and needed intensive care unit care. Unfortunately, some even died. We were extremely fortunate that there were no deaths in the pregnant population for the 2019 to 2020 season. Despite our best efforts, however, less than 35% of the pregnant clients took the vaccine last season. And we could do better. We have more than enough vaccines available for every single woman if they choose to be vaccinated. As you've heard, the vaccine is available at all public health clinics, including our antenatal clinics, and should be available on the very same day when you go for your normal antenatal visits. Just ask your healthcare provider for this. We have also made significant advances in that private obstetricians, we are providing them with free vaccines to give to their clients if they wish to do so. We have heard before the vaccine is safe in pregnancy, and worldwide, millions of doses have been given over the years. It is safe at all stages of pregnancy, so you should not be turned away because you are in early pregnancy. You only need one dose. It takes time to build immunity after receiving the vaccine, so it's important to get the vaccine early in this flu season. The immunity that you get is also transferred to the baby before it's born, as well as when you breastfeed. This gives your baby some protection for the first 6 months of life until the baby can have the vaccine. The vaccine is approved from 6 months of age. In closing, I want to again express my thanks to all our healthcare workers at the forefront of the COVID-19 response, our nurses, our midwives, our support staff, our laboratories, for example. I want to single out just a few people: Professor Bassau and the team at the Mount Hope Women's Hospital, Dr. Jagannath and his team at the San Fernando General Hospital, Dr. Akibo at the Sangre Grande Hospital, Dr. Ishmael at Port of Spain General Hospital, our stalwart in Tobago, Dr. Victor Wheeler, and our neonatal specialist teams led by Dr. Marlon Timothy, Dr. Kamini Lachman, and Dr. Arlette Khan. They need to be acknowledged. Our country says thanks. Thank you for your attention.
And we go now into the question and answer segment. Our panelists are ready to field questions from the media representatives who we invite to indicate their name and the media house that they represent before posing questions. A maximum of 2 brief questions, please. We begin with Guardian Media Limited this morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My questions this morning is to the Chief Medical Officer, but I will ask the first one, and then when I get a response, I anticipate I may have a follow-up. All right. So the first question that I have is, now you said that the swabs that are taken is a function of the amount of people that show up to be swabbed, and you showed us some figures. But I noticed earlier this week that we only saw about 74 samples being submitted on one day and about 86 on another day. Right. Is that the reason why we've been seeing those little numbers, that just not enough people, or no more people are showing up to have their swabs taken? And what are the other variables that could result in less swabs taken in a day?
Right. So in terms of the way, that's why I put up the graph. So basically, as I said, we swab people that present to us with viral symptoms at the health center's primary care setting. That graph is a representative of the primary care centers. People are also swabbed, of course, that present to the hospitals, emergency departments. Generally speaking, as you go to the emergency departments, those with severe illnesses are swabbed in a higher ratio. So the ones with more severe symptoms are more than likely swabbed, maybe even higher than 80% in most instances in an emergency department, for example. So as I said, it's a function. What we normally get is a weekly report from the lab, which is the Trinidad Public Health Lab, which tells me on a given day how many swabs you have per site. As you know, there are different sites that are doing the testing now. So they get from San Fernando, from North Central, as well as Eastern and Tobago, together with what they get coming into Trinidad Public Health Lab, which is usually from Port of Spain Hospital. So it's a conglomerate, and I get a weekly report back from the lab now that tells me what happens per day. And what I saw for last week was about 450 for the entire week, over a period of about a week. In the weeks prior to that, we would have been seeing somewhere between 600 to 700. Closer to the middle of September and the middle of August, we would have been a little bit higher, about almost 1,000 sometimes a day at its maximum. So it is a function. We are trying to swab as many people as we can once they come in with any viral symptoms, no matter how mild they may be. But of course, people can refuse swabbing, and they have, in a lot of instances, said they don't want to be swabbed for whatever reason. But we try our best to swab everyone that presents to us with viral illness. I hope that answers the question.
Thank you. And you have a second question?
Yes, my second question is Now, some concerns were raised about the rate of positivity that we were seeing. I know that on the last occasion when you presented, which I believe was on Saturday, about the rate of positivity being around 9 to 10%. But now that is I know it's an average, and it was taken across the entire of phase 2 when you presented that figure. But if we start to kind of look at the smaller time frames, we're seeing a larger rate of positivity. But what I want to know is, what time frame do you all use, or does the ministry use, when determining our next step or way forward? Is it that you're using the entire phase 2 period to get your rate of positivity average, or are you using a week or 2 weeks? What period is it that is being used?
Well, we try to look at positivity rate even disaggregated beyond entire country level. So we do one for the country that will give us an idea, and it's being done on a daily basis. So the total number of swabs coming in on a particular day, and of course the total number of positives you'll have for that given day. That is the best way to calculate it on a daily basis. We disaggregate it by site as well, so that you will find that you will get maybe a higher level of positivity in persons presenting to an emergency department with severe illness, as opposed to someone presenting to a health center, a rural health center. So we try to disaggregate it as best as we can in terms of site, as well as in terms of the locality, specific locality, to give us an idea of what we are seeing in the community, what we are seeing presenting to the emergency departments. And sometimes, of course, we use the private sector labs to give us an idea of what is happening out there as well. So it's a number of positivity rates across time as well as across geographic distribution to give us a good idea of what our actual population positivity rate is like based on the sample that we are taking.
Thank you very much, CMO. And I-95, we're ready for your questions. I-95.5.
Good morning to everyone. Whitfield Turner from I-95.5. CMO, I believe you will take these two questions. First of all, where churches are concerned, they're seeking some guidance, because at the moment, baptisms are permitted, but the bodies of water required for the baptisms, like beaches and rivers and so forth, remain off limits. So they're asking, what should they do in order to be able to conduct those baptisms at this time, whether they'll have to request an exemption or so forth. And secondly, for service technicians who have to go into people's homes to check up on appliances and so forth, they are growing concerned about the possibility of exposure on their part as well. One of them actually told me that they went into a home to conduct some checks, and they eventually found out that the persons in that home was actually under quarantine. And so they are trying to find out what advice you can give them so that they can conduct their jobs in a safe manner.
Okay, so your first question, and you are right, what has to happen is that an exemption request has to be made to the Honorable Minister of Health for an exemption for a specific purpose. As you know, beaches and rivers are still closed based on the regulation, so an exemption request has to be made. In terms of your service technicians, again, we don't know who has COVID-19. We don't know who is carrying the virus as an asymptomatic carrier. We are asking that we do our universal precautions, as Ms. Sukhchan would have gone through, wearing your mask, especially for service technicians and persons that come in close contacts with persons at home and go from place to place. They wear their mask at all times. Make sure you sanitize your hands before and after you do your work. You stay a considerable distance away from the other occupants of the home when you visit to do your services. And of course, if you are ill as a provider of that service as well, we expect that you declare that to your employer and that you stay away from doing that, because you can be, on the converse side, a carrier taking an infection from one home to the next. So, Mr. Turner, I hope that answers your question.
Thank you very much. And Newsday, we're ready for your questions now, please.
Yes, good morning, CMO, the rest of the panel. Julian News from Newsday. My two questions are, firstly, we've been getting some reports of persons who've had delays in getting their COVID-19 results. And most of the persons, when they finally do get the results, they find out it's negative. So I'm just wondering, our health officials, when the tests are negative, are they reported with the same alacrity as when it's positive? That's my first question. And secondly, we also had a report of a gentleman who had flu-like symptoms who actually called an ambulance asking to be taken to the hospital, fearing he might have had COVID. And the person he spoke to told them, well, no. So I'm just wondering, what is the policy if someone suspects they have flu-like symptoms? Are they able to call the ambulance to take them to the hospital? So those are my two questions. Thank you.
Okay. In terms of the reporting of the cases, as we would have said before, there's a timeline generally for reporting, but as I said, the reporting of positives occurs a little bit quicker because those individuals will be contagious and we want to get them into a quarantine setting as quickly as we can. As you know, there has been a policy about 3 weeks ago or almost a month ago where once one receives a swab, they are asked to home quarantine as well. So you shouldn't have a question that a person is in quarantine awaiting a result. And of course, what we're trying to do is contain. So we want to make sure that those individuals do receive their results in a timely manner. We are working very closely with both the lab as well as the CMOHs in Trinidad and Tobago. Just to clarify for Dr. Hoyt, I had spoken to her early this morning. She did indicate that her backlog was cleared, and she asked me to indicate that, contrary to what was said in the 8 a.m. news, basically what is happening is that she did receive the backlog of reports from the Trinidad Public Health Lab. So we are working closely with both Tobago and Trinidad to ensure that, one, the results are reported quickly from the lab to the CMOHs, and then, of course, that bigger step, which is getting it from the CMOH office to the physicians, and so that the physicians can contact each individual patient and tell them their result. So we're trying to get that process as tight as possible, but it is happening a little bit faster with the positive as opposed to the negative. With regards to your second question, once someone calls the GMRTT hotline 811, they are supposed to be taken to the hospital if they are judged to be in a severe situation. They are supposed to be attended to in terms of the call. So if offline you can send me that information with that specific individual, we can investigate that matter a little further. Okay.
Thank you very much, CMO. Just a reminder, we also have Ms. Sukhchand here and Dr. Serju Singh. We go now to 91.9, please.
Yes, hello, good morning to the panel.
Good morning.
We're in Exeter 91.9 FM. Just a point to note, CMO, we have been starting our Christmas campaign on radio, that our total local Christmas campaign, and one of the people we've been interacting with is hunters. Okay. And some concerns were raised about whether game licenses, how they will be implemented, how hunters are to proceed in terms of collecting wild meat, selling it, and how consumers will consume it during this upcoming Christmas season. And the other question is, could you give us a little bit of an update in terms of how you think the trends have been going between Saturday to now? I know we've been looking forward to reaching to a point of 20 cases per day for the bubble. What kind of progress can we, get from you in terms of those numbers? Are you seeing some good trends or not? Thank you.
Yeah, so in terms of your first question, I believe that will be better handled by the Ministry of Agriculture, and we'll be happy to pass it over to that agency. With regards to your second question, we would have seen some continued downtrending in terms of the daily when we have built out our epidemiological curve. Again, somewhere between a little less than 30, 30 on some days over the past few days. But I think we'll report that on Saturday. We'll probably put our epidemiological curve, give us a week of data to go into that curve so that it will be able to tell us how that trend is looking. So on Saturday, we will look to present that again so that we can actually have a week of data being populated in that graph so that we could have at least a good idea of what is happening at least until the middle of this week. But it seems to be going in the same light with a slight decrease in number of cases. But I don't want to preempt what is going to happen at the end of the week.
Thank you. And now we move to IETV, please. IETV. We're having a little difficulty hearing you.
Okay, are you hearing me now?
Yes, perfect. Thank you.
Okay, hi. Morning, everyone again. Binama here, some IETV news. I have two questions. The first one is to Ms. Sukhchand. Ms. Sukhchand, many members of the public are calling our newsroom and messaging us concerning the vaccine. They're wondering if they got the influenza vaccine last year, do they still have to get one this year? And my second question is for the CMO. In terms of mandatory swabbing, And patients who are to be warded at the hospitals, are they swabbed before they are warded? And for example, a child, I understand that children are swabbed before they are warded, and parents would obviously have to stay with the children. So does the parents have to get swabbed as well? And my final question, if I am allowed, the Cinema Operators Association, I know they sent out a release concerning they're still waiting on feedback because they have like 1,500 members or 1,500 employees who whose jobs are at risk, and they're saying that there's no proof locally, at least, that there has been spread of the virus within the cinema environment, and they're asking for some sort of communication on whether or not they can reopen their cinemas and their services. So any updates on that as well is appreciated. Thank you.
Okay, let me answer All right, so the third question, of course, the regulation as it states now, cinemas and theaters are to be closed at this point until the regulation ends. The decision has to be made by the Honorable Minister and the Prime Minister as to whether someone will, one of those agencies that already closed based on the regulation, that will be considered later on in the period, as the Prime Minister indicated. If you could just ask your second question one more time quickly. I didn't get the last part of it.
The second question is in terms of mandatory swabbing for patients who would be hospitalized and warded. For example, children. If children has to be hospitalized, are they required to be swabbed? And parents who stay with them, because parents may want to interchange. Do parents have to be swabbed as well? And do they have to wait? How long would they have to wait for the results before they can be warded to be treated?
Okay, so not all children, I don't know if you mean, or not all children that are warded for any medical illness or surgical illness will have to be swabbed for COVID-19. If you have COVID-19-like symptoms and you present to one of the swabbing sites or the emergency department, then of course you will be swabbed, bearing in mind that not every positive remains in a hospital setting unless you're ill. All right. So if you're well enough to remain at home, your swab comes back as positive, you will be allowed to go home, the parents will be considered primary contacts, and of course they will have to be quarantined with the child. They don't necessarily have to be swabbed until they possibly develop symptoms, unless they have symptoms at the time. So generally speaking, if you're warded, a pediatric patient is warded for any medical condition that is not specifically respiratory in nature, for any other, there's no necessity to have a swab. There's no such thing as a mandatory swab. Patients, it has always been voluntary and based on the signs and symptoms that you present to the facilities with. Yes, Dr.
Okay. Thank you for your question. I would reference to persons who have received the vaccines before, whether earlier this year or late last year. Should they get this new vaccine? Yes. And as I mentioned before, the seasonal flu vaccine was updated to match the viruses that is expected to be circulating. And for Dr. Surjusing also mentioned there are two types of the influenza, type A and B. And for both type A, the H1N1 and H3N2, the component has been changed to match the circulating virus, as well as for the type B virus. So yes, the vaccine has been upgraded and definitely to match the season. So we recommend that persons take the vaccines, although you would have received vaccines earlier this year.
Thank you very much. And just a reminder to our media representatives, 2 questions, please. We go now to Loop TT.
Hi, good morning, everybody. Nika Pasanal here from Loop. I know we've spoken about it before, but especially as the flu season begins and COVID-19 is a bit more understood now, can we properly differentiate for people who may be infected with one or the other, the difference in the symptomology of the regular flu virus and COVID-19, just so they may be able to alleviate themselves of some panic? That's it.
As we said before, the influenza as well as the COVID-19 symptoms are almost identical in terms of the way people present. So someone sitting at home with flu-like symptoms or with COVID-19 symptoms, it will be extremely difficult for a patient to tell the difference. It is extremely difficult even for a clinician to tell the difference when you first present. A lot of the symptoms are the same. You get fever, you get sore throat, you get headaches, you get runny nose, there's a lot of the same symptoms that present with both. There has been some research that suggests with COVID-19 you see more of loss of taste and loss of smell, but it can occur with the influenza as well, especially loss of smell. So it is extremely difficult to tell the difference for patients. And as Dr. Singh indicated, one of the only ways we can tell the difference is to actually have a test done. So anyone with flu-like symptoms, we're asking you to present, and we will have your COVID-19 test done. If you are negative for COVID-19 and you have severe symptoms developing, what we do is the Caribbean Public Health Agency is able to test for H1N1, H3N2, type Bs as well, and 13 other pathogens of the respiratory type. So we will, once you have a COVID-19 negative test, we are also testing for other viruses that are in circulation. So basically, present. Once you have symptoms, we will test, and then we will know what we're dealing with in a better way, but they look very much the same.
Okay. Thank you very much, CMO. And we go now to TV6.
Hi. Good afternoon.
Good day.
Alicia Boucher from TV6. Initially, I wanted to ask whether we were seeing a trend in terms of moving back from this community spread to localized clusters, but I know that the CMO said that a graph would be presented on the epidemiological data over the weekend. So my two questions would be, I think it was mentioned that there were no deaths in the 2019 to 2020 flu season. And I wanted to just get a clarification whether that statistic refers to only pregnant women. If so, how many deaths were recorded outside of pregnant women, outside of COVID-19, from perhaps other flu viruses, let's say H1N1? That's my first question. And the second question is, during Rashad's question, it was mentioned that there are persons that have refused swabbing. So if a person presents with flu-like symptoms and they refuse to be swabbed, what happens next?
Okay. So I don't know if Dr. Singh wants to reiterate what he said with regards to the pregnancy-related deaths.
Sure, thank you, CMO.
Mm-hmm.
So in terms of pregnancies, yes. So in seasons prior to the 2019-2020 season, there were patients who got critically ill who were pregnant, and some would have died. But for the 2019 season to 2020, there were no deaths in the pregnant population. Outside of the pregnant population, however, we had recorded at least 41 deaths from the flu for that season. I hope that answers your question, Ms. Boucher.
Yeah, so thanks, Dr. Singh. So in terms of the deaths, the 41 were confirmed by the Caribbean Public Health Agency, as I described with the question from Loop News. They were confirmed to the most part to be due to H1N1 type. In terms of your second question, someone presents with viral-like symptoms, they refuse to be swabbed. As I said, it's voluntary. We can't force anyone to be swabbed. What we have been advising is that persons self-quarantine or self-isolate, for the period of their illness to prevent the spread of whatever it may be. It may be the common cold, but even so, we want to keep the viral levels low. If we are not able to swab, we're not able to tell on the outset whether it is COVID-19. So we can err on the side of caution and say quarantine for the period of time, or isolate for the period of time that will allow us to be confident that when you come out of isolation, you can't spread the virus any further to anyone else. So that's what we normally do if someone refuses to have a swab taker.
Okay, thank you very much. I see that we're supposed to go to CL Communications. I don't know if the connection has been confirmed. Can we go to Caribbean CL Communications? Okay. All right, I think we will go to TTT then.
Oh, CL.
Hello, are you hearing us?
Good morning.
Oh, good morning. So we'll stay with CL Communications.
Good morning.
Good morning.
Are you
Please
hearing
pose
me?
your question. Yes, we are.
Good morning.
Okay, so we'll go to TTT while we try to determine what's happening with CL Communications. Can we please have the questions from TTT?
The mic is open.
Hi, good morning. Sonal Lala, TTT News. CMO, I've gotten information from at least two separate families whose elderly relatives would have passed away recently. One would have died at hospital and one would have died at home. Now, the persons would not have been tested for the COVID-19 virus prior to passing away. I'm asking, what's the criteria for testing these persons who may have died? And has any of these deaths been recorded in the number of total COVID-19 deaths so far?
Okay, so generally speaking, anyone that you would take it in two separate ways. So you have one person that have passed away at hospital, you said, and one at home. So generally speaking, when someone dies out of hospital, the district medical officer will visit together with the police to determine. The police will first say whether they think that the death was due to foul play or not. Once they say that it's not due to foul play, generally speaking, the district medical officer, by taking a history and getting in touch with the physician of the deceased, if there's one that can be contacted, will try to ascertain a cause of death. For example, someone may have a history of cancer, long-standing history. The physician of that person will know clearly well that they have died from that disease. There have been no flu-like symptoms within the last 2 weeks. Then, of course, a cause of death can be determined. In cases where it can't be determined, for instance, the person may have had a flu-like illness or you would have been in contact with positive individuals, we can do testing posthumously, so after death, and those have been done routinely through the Forensic Sciences Center with all their cases over the past, since March, I believe it would have begun. So we can test after death in terms of if it happens at a hospital. Normally what happens once the person is in the hospital setting for more than 24 hours, a cause of death can be determined. It may not be linked to influenza, then of course the same thing pertains. If they're within the hospital setting, generally speaking, very ill, we are taking COVID tests from those individuals in most instances. And then of course sometimes we get the result. If the death is right away, we may get a result afterwards that indicates that the person would have died from COVID-19. So that's how we go with different types of deaths.
Okay, thank you very much, CMO. And we go to Guardian Media Limited for a repeat question, please.
Hey, good morning again. Okay, CMO. So just to follow up again on that issue that you said where persons can refuse swabbing. So now it has me wondering, can a patient refuse treatment? Because I know in normal circumstances, this is an option. It's a right of a patient, as a matter of fact.
Right.
But with COVID-19, can a patient refuse to receive any treatment? Has it happened? And what is the protocol for that, if it's possible?
Okay, so a patient can in any case refuse treatment for any condition, right? They could sign to actually leave hospital discharge against medical advice form, which happens in the normal non-communicable setting. The reason we had added COVID-19 to the schedule for the Quarantine Act on January 31st, if you recall, is to ensure that if someone looks as if they have COVID-19, it gives us the authority to quarantine or isolate that person under law until we either deem them non-infectious. We may not be able to administer any treatment. We may not, if they refuse, but at least we can isolate them to prevent the spread of further diseases, which is what the quarantine amendment allowed us to do since January 31st.
Okay, thank you very much, CMO. And we go to CL Communications. I think you have 2 questions for us, please.
Yes, good morning again. Sorry about that just now. Basically, I just wanted to find out, for the counties which you have high numbers in, have an investigation been done with regards to what is causing those high numbers? And secondly, concerning TNTEC and PTSD and essential workers, are you satisfied that the COVID-19 protocols are being observed? Thank you.
Okay, so in terms of your first question, having a county in particular with a large number of cases, it's multifactorial in terms of the way it happens. It could be large clusters of cases occurring in one particular jurisdiction. What we have seen traditionally, not only with COVID-19, but with other infectious diseases, is they would have been predominantly spread among the community centers. So areas where you have large built-up areas. We saw in the early days, we had spread among the East-West corridor. It migrated to County Caroni and then to Victoria, where there's a large group in that particular county at this time. So it is multifactorial. We are looking to see if there are clusters presenting themselves for any particular reason, being linked to each other. But to the most part, we just see the evolution based on the number of persons living in a given jurisdiction being large. There's close proximity to each other. There's large movement. As again, I said, in the urban centers, you have higher predominance of communicable disease, especially respiratory disease, occurring. With regards to TNTech, PTSD, generally, the guidelines, what we are seeing is being adhered to. I get a report from my Chief Public Health Inspector on a Friday where they do inspections of various business places, food establishments, and the compliance has been fairly good. I would say, to the most part, 80 or 90% in terms of adherence to the public health guidelines within those institutions and organizations.
Thank you very much, CMO. And 91.9, I believe you have a follow-up question.
Yes, hello. We're next to again, 91.9.
Thank you, Mr. Extavo.
CMO, the use of the vaccines to treat with the influenza virus, should that give us a clear indication then that persons who are vaccinated that may subsequently show up with flu-like symptoms may be a little bit more likely to have COVID-19? Is that one of the criteria looking at, that more people get vaccinated so they have less confusion with whether it's COVID-19 or influenza? Is that part of the consideration with the push of the vaccines now?
Well, the vaccine is really to protect everyone from influenza in the first part. So we're trying to protect the population as best as we can from getting the influenza virus. We know there's coexistence in some research in other parts of the world with influenza, persons being able to have both at the same time or in very close temporal relationships. The vaccine, however, it's a good question, because if someone has the vaccine, based on the efficacy of the vaccine, it is, and you ask that while the physician takes the history from that person, they have flu-like symptoms, and they would have had the vaccine, then of course the likelihood of it being influenza will be less. I can't say it is completely that they won't have influenza, because there's a small percentage of people, of course, that take any vaccine that it won't cover that individual, but the likelihood of it being influenza will be less. And of course, COVID-19 or any other virus is, of course, more expected in those individuals. So it's a question that we do ask at the outset when we're having the history taken for influenza or flu-like symptoms, whether you did have the vaccine or not.
Okay, thank you very much. And I-95.5, I think I see your hand up for another question.
Yes, it was. I just want to get some clarity here. A few days ago, the Ministry would have put out a release with a recall of a particular drug, a particular batch. And it stated that that drug was only used in the private healthcare sector. So I'm wondering, what would cause certain medications to only be used in the private healthcare sector as opposed to the public healthcare sector?
Okay, so basically, I don't think it's just a matter of supply chain. So the Ministry of Health will usually procure its vaccine through the Pan American Health Organization, through their revolving fund. So private sector will procure vaccines from various sources outside of that. So the source is probably different, and therefore the source that was procured for this particular vaccine, it's a vaccine, which we put out a couple of days ago. We had a press release. It's a hexavalent vaccine that contains 6 different viruses that are given in the private sector, not in the public sector, because the one we buy is a pentavalent vaccine, plus we give another vaccine to add to make it 6. So it's 2 different vaccines, but it's just based on what the procurement stream was like, that the private sector bought it and the public sector didn't have it. Okay, Mr. Turner.
Thank you very much. And we have another question from Rashad Khan of Guardian Media Limited. Yes, please go on, Mr. Khan.
Hi, morning again.
Great.
Yes. Okay. So last week, the Prime Minister indicated, hinted to us our intention to join the CARICOM travel bubble. And a key proponent of that is that we will no longer, or people moving within the bubble will not need to quarantine or have any PCR testing done. Has any discussions come up within the Ministry of Health? And is that something that we're going to be okay with if we do join that bubble?
Well, the CARICOM bubble is something that the CARICOM heads are meeting. They have met on, and they continue to meet on. It has not been finalized, but that matter is to be dealt with at the level of the CARICOM heads. The Prime Minister will continue to have those talks, and once a decision is made, of course, I think he will be in a position to better say and advise the population.
Thank you very much, CMO. And we go now to, I see one last hand, Mr. Turner. Quick question, please.
Yes, thank you. Just wanted to get clarified from my earlier question regarding the churches and baptisms, whether any requests were actually submitted for exemptions, and if so, how many?
Okay. Yeah, as I said before, normally those exemptions are made to the Honourable Minister, but I haven't seen any come across my desk as yet. Yeah, so.
Okay, thank you, CMO. And we go to Ms. Sukhchand, who will just give a little reinforcement about the flu vaccine.
Thank you, Candice. So once again, we want to urge the public to come out and get your flu vaccine. We actually have a vaccine against influenza. We don't have a vaccine against COVID-19 at this time, but we can give you a vaccine to prevent you from developing the influenza vaccine or the severity of the influenza vaccine. So please,
Go ahead.
So please come out, call your health centers, check the ministry websites for the areas listed where the vaccines are available, and take your relatives to get the vaccine as well.
Thank you very much, everyone. We have come to the end of today's media conference. Thank you again for your participation. Remember, protect yourself and your loved ones, everyone, from COVID-19 and the flu. Get the flu vaccine today and follow the new normal guidelines.